Hi, I'm Jennifer Mautone from the Department of Child and Adolescent Psychiatry and Behavioral Sciences and Policy Lab at Children's Hospital of Philadelphia. I'm excited to talk with you today about our paper focused on behavioral health screening with a particular emphasis on evaluating patient strengths. We know that 1 in 5 children and adolescents have behavioral health difficulties, and many of these youth receive their behavioral health care from their primary care clinician. In particular, primary care clinicians play a very important role in screening for behavioral health problems and supporting families in accessing care. According to the American Academy of Pediatrics, screening for behavioral health difficulties is an important element of practice to assist in early identification of difficulties and to encourage timely access to care. In order to best help clinicians identify the behavioral health needs of their patients, we developed the Behavioral Health Checklist to ensure the availability of a screening measure that is reliable, valid, and developmentally and culturally responsive. There are 2 versions of the scale, one for children ages 4 to 7 years old and one for ages 8 to 12. The Behavioral Health Checklist includes subscales that screen for internalizing problems or anxiety and depression, externalizing problems like disruptive behavior, and attention deficit hyperactivity disorder. In addition, a unique feature of the checklist is that it includes a subscale to evaluate patient strengths, or indicators of resilience, which are important protective factors in the face of adversity or stress. This is particularly important now, given the increased focus on resilience during the COVID-19 pandemic. Our approach in developing this checklist is consistent with a dual-factor model of mental health. In the dual-factor model, indicators of health or wellness are considered separately from indicators of psychopathology, such as symptoms of anxiety or depression. We know that both domains make independent contributions to youth social and academic functioning. Health and wellness competencies, including self-regulation and interpersonal skills, are indicators of youth strength or resilience in the face of adversity. The strengths subscale of the Behavioral Health Checklist includes items designed to assess these characteristics among youth. The purpose of this paper was to evaluate the validity of the strengths-based items of the Behavioral Health Checklist and to determine whether the degree of youth strength buffers the effect of the level of child psychopathology and impairment in social functioning. Our sample included almost 1,400 youth of diverse race and ethnicity and socioeconomic backgrounds. To examine the validity of this scale, we conducted factor analyses of both versions. Our findings indicated that the Behavioral Health Checklist has a single strength-based factor, regardless of child race and sex, and family's socioeconomic status. We also found that increased internalizing, externalizing, or ADHD-related difficulties, plus a lower level of strength or resilience, predicted increased social problems in our sample. In addition, our findings suggested that higher levels of strengths may buffer the harmful impact of psychopathology symptoms on social problems. For example, in this illustration, you can see that children with internalizing difficulties and higher strength scores have fewer social problems than those with internalizing difficulties and lower strength scores. Our findings suggest that the Behavioral Health Checklist may be useful in identifying protective characteristics that can be strengthened to promote children's social success. Our research is particularly timely in that it provides a method of screening for factors that can promote children's resilience during periods of high stress, such as the current COVID-19 pandemic. In future research, we would like to consider the needs of adolescents and patients and families whose preferred language is not English. Thank you for your time.